Good afternoon, everyone. Sorry for the delay here on this. This was supposed to be at noon and we had some technical difficulties. So glad to be here though, and welcome to my webinar series. I'm going to add in, let me see here, this, and here we go. So, just a little heads up. So if you have questions at all during the webinar, either ask via Zoom if you're on Zoom or ask via the Facebook chat live, and I will get to them at the very end. All righty. Okay, so talking today about constipation, diarrhea, and the microbiome. So the main objectives for today are, do we need a healthy gut for a healthy life? What is the microbiome? What do I do when my child has constipation or diarrhea? Why is my child's gut health compromised? How can I rebalance my child's gut? And what simple ways can I heal my child's gut and immune health? Child's gut health and immune system. So let's begin on this journey. So first of all, why do I care about gut health? I personally have had many troubles with my own digestive system, which is actually what led me to naturopathic medicine itself. So it's near and dear to my heart. There we go. There it is. Okay. Secondly, I see a lot of symptoms that are caused by digestive imbalances. The core of naturopathic medicine and really health in general comes from chronic illness, or I'm sorry, comes from digestive gut health, which is why, no matter what I'm treating, I always go back to gut health. So it's so important to get your child's gut health ready to be growing, developing, because some of the symptoms that I see with impaired gut health are weakened immune systems. I see weight gain, fatigue, anxiety, depression, pain, acne and other skin issues, rashes, food intolerances, gas, bloating, etc. So it's important to get gut health taken care of and healed. Why do I need a healthy gut to live a healthy life? Well, we have this thing called the microbiome. Some of you may have heard of that. What the microbiome is it's a community of microorganisms. Some people say bacteria. There are viruses, fungi in there, and they inhabit our gut to help keep us healthy and functioning optimally. Goodness, excuse me. And so we want to make sure that that microbiome is balanced. An imbalanced gut flora can lead to a lot of symptoms, like I mentioned in the previous slide, pain, inflammation, autoimmune disease. And so when it's imbalanced, it's called dysbiosis. And that then can lead to many things. And I'll get into leaky gut in a moment here, but dysbiosis can come from leaky gut, it can come from infections, it can come from C-section birth, diet, not breastfeeding, and it then can result in bloating, gas, constipation, diarrhea, colic, ear infections, among other things specifically for kiddos. Another thing that I wanted to mention too is that 70% of our immune system is actually located in our gut. So this kind of explains why when our gut health is off, so many other things are off or weakened or imbalanced. And so speaking of, not breastfeeding or C-section birth. So to get into that a little bit more. So at birth, when we're born vaginally, we get all those nice juices from our mommies, and in there is bacteria, healthy bacteria that comes from her microbiome that then is given to the child to help support their immune system and help to develop their digestive system right off the bat, because we are all born with leaky gut. And the mother's microbiome in vaginal delivery and breastfeeding, it is what really heals or brings together that leaky gut. So that's the reason why vaginal delivery is much more beneficial for kids than C-section. C-section, if you think about it, it's a lot more sterile. There's no yummy juices to come out of the vagina onto the baby and into the baby. So there's a lot more, I don't want to say complication, but there's a lot more risk for leaky gut, lowered immune system, digestive health. Also with breastfeeding, there's a lot of good beneficial bacteria, things that come from the mother's milk that help to develop the digestive system, to develop the immune system, really to develop the whole child. And when we use formula, we don't get all of that good stuff that the mom has that is supposed to be given to the child. Now, of course, there are times it's just out of our control, and we can't give birth vaginally, or we're not able to breastfeed, and that's understandable. And then that's where it comes, other things come in to take care of the child, such as probiotics, which we'll also get into. Okay, so there have been studies saying, well, probiotics have shown to support kids who have asthma to decrease their symptoms, also to improve atopic dermatitis. So that's basically the immune system. So if babies aren't getting those natural probiotics from mom, then it might be a good idea to supplement with probiotics. It's a case-based thing, so I would recommend talking to your doctor about that. But, I get the question a lot, well, are probiotics good? Should I be taking probiotics? Should my kid be taking probiotics, etc.? So that's an important thing to think about for sure. But moreover, that breastfeeding and vaginal deliveries are going to help balance the gut. Okay. So speaking of leaky gut, so I mentioned that a few times now. So what leaky gut really is the tight junctions are supposed to be like this in our gut, right? We're supposed to have a tight gut so that when we eat or drink things, or things coming in from the environment, they can go straight through our intestines and out to be excreted. And then we absorb whatever we need through those, through the intestines. Now, when leaky gut happens, which can come from, like I said before, that comes from medications, food intolerances, stressors, a lack of breast milk, lots of things, then our gut becomes leaky. And those tight junctions they either don't come back together, because remember I said we're all born with leaky gut. They either don't come back together, or if they do, and later on in life, maybe a 10 or 12-year-old gets leaky gut, those tight junctions come apart. Then the things that come into our body from the outside, they don't go straight through our gut. They now get out into the bloodstream. Okay, so then we're not able to absorb all of the nutrients that we might have with the food or beverages that we're drinking. And also when it gets through the bloodstream, now it becomes systemic. So larger proteins, toxins, bacteria, they get out of the gut, which is a contained area, and now it's in the bloodstream, and it can go all over the body. And that causes, it causes infections, it causes inflammation, it causes food intolerances, it causes allergies, eczema, dermatitis, things like that. And that all comes from the gut. So that kind of explains why having a healthy, tight gut is really important for the whole system. Good news is that we can actually heal leaky gut. There are things that we can do to support the coming back together of those tight junctions. And that could be via diet, that could be via supplements, lifestyle, lots of things. So that's really a benefit to working with a naturopathic doctor, but knowing that those gut cells and really all organs in the body, they do regenerate when we take away what's causing the degeneration. Okay. All right. So then another question I get from a lot of my patients is, well, why hasn't my doctor told me this? Why hasn't my pediatrician told me this, or my primary care doctor? Well, sometimes, treating the symptoms for some people is easier than taking the time to investigate and finding the root cause. Okay, so dysbiosis is not normal, but it's very, very common, and it's very treatable. It sometimes does take some investigation. It sometimes does take some hard work for the patient as well to find the underlying cause of disease and heal the underlying cause of disease versus just putting a Band-Aid on top of it, which, isn't long lasting. So sometimes I think of explaining it like, well, it's really easy to put a Band-Aid over a cut, right? But if every morning we're waking up with a cut that somehow we get every night, the Band-Aid isn't stopping the cut. The Band-Aid is just covering up the cut, right? So we want to find, well, what the heck is making this cut in the first place? Let's get rid of whatever is making that cut so that it can heal up on its own, right? So it's important, always ask why, always ask what, always ask how. Ask your doctor, because the body doesn't do anything randomly. There's a reason for how the body works. And sometimes it gets a little off kilter and things need to, be rebalanced. And it's important that we do that. Otherwise, that's what causes dis-ease, right? Okay. So the first main thing I'm going to talk about today is diarrhea in kids. So some of the main causes of diarrhea in kiddos come from microbes in the gut. That comes from the food we eat, the water we drink, our air, our environment, etc. Food intolerances or allergies, an enzyme imbalance. So enzymes being the digestive enzymes that our body makes on its own to help break down, digest, absorb the things that we eat or drink. Thus, if we're not properly breaking things down, we have malabsorption, or leaky gut causes malabsorption, and irritable bowel disease like ulcerative colitis or Crohn's disease. Now, irritable bowel disease can sometimes be out of our control, but it still causes diarrhea and it still is treatable. So that's why I included that here. And then I didn't talk about this, food intolerances. So a lot of people say, oh, I can't drink milk. If I do, I'll be running to the bathroom. That's kind of where that comes from, the food intolerances, allergies. So diarrhea, like I said, the body doesn't do anything randomly, right? There's a reason why the body has diarrhea. It's to get rid of a toxin or something that the body notices as poisonous. So, but then there's a point when diarrhea can become dangerous. And when it becomes dangerous is when the child can't keep any food down, thus they're not getting enough nutrients, they're becoming malnourished. With severe dehydration, as you know, diarrhea causes dehydration, so making sure that we're getting enough liquids in to equal out what is coming out. So dehydration, vomiting, extreme fatigue. Now, kids are going to be tired with diarrhea, but when it becomes extreme, it can be dangerous. And then over the long term, failure to grow is another reason or time when diarrhea can become dangerous. So some of the common treatments for diarrhea. Now, in the conventional medical world, a lot of doctors will give antibiotics, or they'll give something to stop or slow down the bowels. Now, let's talk about that for a couple of minutes here. So antibiotics, they can be beneficial in very specific circumstances. However, they can also be detrimental. Now, the reason for diarrhea, well, it could be a bacteria, but it could be a virus. It could be a fungus. It could be, a food intolerance. And so giving antibiotics at that point, then, if it's not a specific bacteria that is causing the diarrhea and the child takes antibiotics, well, that then can actually be worse for the child than doing something else, because antibiotics, well, a couple things, they cause leaky gut, number one. So diarrhea causes leaky gut. Putting antibiotics on top of that could be making it worse. Also, if it's not the right strain, the child can become immune to the antibiotics. So we want to try to stay away from those as much as we can. The other thing is the certain things to stop or slow down the bowels. So some of you have heard of Imodium, for example. So thinking about that, well, if the body needs to get rid of a toxin or poison, well, I don't want to slow it down. For example, let's say we go somewhere, we have some meat, and we become poisoned, food poisoning, right? Well, the body needs to get rid of that because it's becoming toxic to our body. So it wants to get rid of it. Stopping the bowels is, of course, diarrhea is uncomfortable, right? But just stopping them isn't killing the microbe, and it's also keeping the microbe in the body longer. Okay, so more importantly, we want to get at the cause of the diarrhea, that being the microbe or whatever it may be. So in the naturopathic world, we approach it a little bit differently. We look into, okay, what is causing the diarrhea? How can we get at the cause, underlying cause, and treat that? So with that, we do some dietary changes. That may be taking out an offending food or beverage. That could be increasing fiber, increasing foods that are easy to digest during the time, things like that. Adding bulk to the diet, that's a little bit further down. And foods that add bulk could be apples, carrots, rice cereal, chicken, and potatoes. Those are all fairly easy to digest, but they add a little bit of bulk without completely stopping the stools. Also restoring and maintaining hydration. So we want to get those electrolytes back in the body, balance out the acids and bases. That could be through Pedialyte, that could be through water broth, okay? Probiotics, we kind of mentioned that, but adding in probiotics to help rebalance the gut there, rebalance the microbes, and to crowd out some of the more negative gut bacteria. And like I said, treat the underlying cause of disease. So if it's a more chronic type diarrhea or lasting a little bit longer than a couple days, we want to do some testing. We want to look at, okay, well, what is causing this? What can we get rid of or treat in order to get rid of this diarrhea? So we could do stool testing, we could do food intolerance testing, things like that, and then treating those things. Additionally, we can use supplements, herbs, homeopathy, things that will help treat the underlying cause of disease. Okay, and then moving on to constipation. So I get a lot of patients coming in saying, oh, well, I went and got imaging and they said I'm constipated. And they could have gone for a little bit of pain, a little bit of gas or something like that. And so I wanted to write the definition here of constipation. So constipation is less than 3 bowel movements per week, or more specifically for children, sometimes that can just be bulky or hard stools. So if you look at the Bristol stool chart I have here, it might be a little bit small on your screen, but type 1, 2, and 3 may be classified as constipation. They're hard to pass, not much is getting out. They can be straining, bulky. Okay, so those can be constipation for kiddos. Some of the causes of this are physical malformation. That could be the actual digestive system is not, in the right place. Something could be, moved or strained, things like that. Food intolerances can cause constipation, dehydration, dietary changes, whether that be, something that was just introduced to the child and it's new. The body, might take a little bit longer getting used to it, digesting it. That could be something that they ate at school. That could be too much of a certain food. So lots of things there with dietary changes, but that can cause constipation. Early toilet training or holding while at school. So if the child isn't ready to be potty trained, that can cause some constipation there. They might be afraid of potty training. They might not know exactly when they need to go. And sometimes potty training can be a little bit of an emotional process for some kids. So noticing that. Holding while at school, some kids do not like to go number 2 at school. They don't want to go around, other people in an unknown area. And they're really only comfortable at home. So knowing that, talking to your child about that is going to be helpful. Emotional causes, that could be, stressors, that could be embarrassment, that could be, not feeling like they're ready to potty train or kids are pretty emotional, and our second nervous system is in our gut. So we find that emotions are oftentimes manifested in the gut. Because we hold a lot of stress there. It's very receptive to outside stressors. So again, talking to your child about their emotions. Are they sad? Are they happy? Are they angry? If there's a time where constipation comes about, that could be a trigger for them. And then medications. Medications can be constipating. So looking into that. But usually in kiddos, constipation is fairly temporary. It doesn't last too long. Oops. Okay, so typical naturopathic remedies for constipation, dietary changes. So looking at, do we have food intolerances? We need to take things out. Do we need to change their diet to be a little bit higher in fat, lower in carbohydrate or meat? Just based on that specific child. Adding in fiber to the diet might be another way to change the diet. Leafy green vegetables, things like that, to help support the bowels. Down a little bit further, I have some foods that I've listed that are higher in fiber. So prunes, beets, blueberries, green leafy vegetables. And then flaxseed slurry is something that I have down there too. And what you can do is take fresh organic flax seeds, simmer them, and then strain a few drops of that kind of that slurry into a baby's food or a child's food. That can help move the bowels along. Then I have increased fluid intake. So again, dehydration can sometimes be a cause of constipation. We want to make sure kiddos are getting, kids older than 9 months, about 1/3 of their body weight in ounces of water per day. So let's say they're 90 pounds. We want to get at least 30 ounces of water or broth or something into them daily. So I often tell parents, have a little bit of, or a reusable water bottle. I like stainless steel for your kids to bring to school and have on their desk, so they don't have to, ask, can I be excused to get water? They don't have to be embarrassed or anything. If they feel thirsty, they can just drink it. Also, kids are pretty active, right? So they're outside, they're not carrying around a water bottle, they're not really thinking about drinking even. And they're sweating. So again, that's another important thing to just educate your child on. And again, that water bottle helps out. We can do, besides food intolerance testing, stool testing, we can do imaging as needed to see, is there an issue with the time it takes, the transit time, for food to get down to the intestines and then out of the body, things like that. Another thing, regular toilet time. So especially as we're potty training or kids are starting to go to school, making sure that you are reminding them to go first thing in the morning when they wake up, maybe before they go to school even, and after each meal. So that kind of gives them a routine of, okay, I should go potty now, I need to go potty now, and just getting in that idea of them thinking, should I go now? Is this a good time? And then I mentioned this with diarrhea as well, but supplements may be necessary and can be helpful, especially when we're treating the underlying cause of constipation, but they should be monitored by a doctor for safety and efficacy there. So we do have a lot of tools in our toolbox as naturopathic doctors, and it totally changes based on individual. One child's presentation of constipation can be completely different than another child's presentation of constipation. So making sure that we're knowing that and taking that into account as we create treatment plans for these kiddos. And another thing I wanted to mention is that we want to, as naturopathic doctors, I want to give the least harm necessary, right? So that's why oftentimes we start with dietary changes, lifestyle changes, looking at environmental stressors, looking at sleep patterns, hydration, nature, love, parents' love, all these things go into health. And so it's really important that I take that into account before going on to supplementation and things beyond that, like medications and such. So that's an important thing to remember there. So a little bit of a summary here. So you might be thinking, okay, that was a lot of information. Okay, I need to think about this for my child. Now, what can I do for them? So really just keep it basic for yourself. Support your child's immune health from the start. That is, when you can, vaginal deliveries and breastfeeding. And then as needed, there's probiotics, right? Supporting the immune system with love, with hydration, with good sleep. And then maintaining a basic diet, not something that's really elaborate. It's not something that's just like the American SAD diet, right? Things that are processed. We want to make sure we emphasize colorful fruits and vegetables, high quality proteins. We want to make sure they're getting enough fiber. Okay. And then at certain times we can assess for food intolerances. Especially if kiddos are having, skin rashes, acne, eczema, things like that. That's a really good time to assess for food intolerances. And for certain kiddos, limiting grains, dairy, and sugar can also help keep the bowels happy and moving. And then supporting your child's ability to create healthy poops. So again, that comes with routine, with stool times, that comes with good sleep times, hydration, and using herbs and other nutrients to support as needed. So some take-home points for you guys. You don't need to suffer. Your child doesn't need to suffer. Some of these things can be quite common, but they're not always normal. So make sure you remember to ask. We're here for you. You can achieve a healthy gut. Your child can achieve a healthy gut. It is totally possible. And poor poops don't have to scar you. Okay, they can be really challenging and overwhelming. And there's a lot that, especially your kid doesn't speak yet sometimes, and you don't know, you can't see inside their little body. But there are ways to assess. And so don't fear. Don't be scared. And your child is a powerful little human. There's a lot going on in there. There's a lot of development, a lot of growth. So remember, they are powerful, and their body will respond. So with that, what do you want to create for you and your child? Is this something that you want to dive further into? Is this something that your child might be struggling with? Your free, no risk next step would be a free 15-minute discovery call with me, answering any questions that you have about, the way I approach things. Maybe if you're wondering if I can help your child or you, that would be a great no risk next step, is just have a phone chat, 15-minute free phone chat with me. So again, I thank you guys so much for listening, and I will see if there are any comments here or questions. I don't see any questions. So with that, if you guys do have any questions, whether they come up later, give us a call. I'm pretty easy to reach when I'm here in the office. So give us a call, comment on this Facebook video if you have any other questions. I will be happy to answer them. And with that, go forward with health. And I hope you guys are having a wonderful Wednesday, and we'll see you next week, Wednesday at noon, for the next webinar, which is on gastroesophageal reflux and proton pump inhibitors. So in kids, and that might help you too. But all right, thank you all so much. Have a good one.